Neomycin-Colist-Hc-Thonzonium Drops, suspension, is used to treat outer ear infections caused by bacteria, such as swimmer's ear. It contains neomycin and colistin, which are antibiotics that stop the growth of bacteria. Additionally, it includes hydrocortisone, an anti-inflammatory corticosteroid that reduces ear swelling and discomfort, and thonzonium, which helps the medication pass through dead cells and pus inside the ear. This medication only treats bacterial ear infections and should not be used for other types of ear infections. It's important to note that unnecessary use or overuse of any antibiotic can lead to decreased effectiveness. As for the daily dosage and optimal timing, be sure to follow your doctor's instructions. When using Neomycin-Colist-Hc-Thonzonium Drops, suspension, it's important to follow your doctor's directions. Typically, you will use this medication 3 or 4 times a day in the infected ear. Before using the drops, make sure your ear canal is clean and dry. It's important to only use this medication in the ear and avoid using it in the eyes. To ensure you are using the right amount of medication and to avoid touching the ear with the dropper, it's best to have someone else administer the drops if possible. This can also help reduce the risk of dizziness. Before applying the ear drops, wash your hands and avoid touching the dropper tip or letting it touch your ear or any other surface. Be sure to shake the container well before using. When applying the drops, lie on your side with the treated ear upward. Hold the dropper directly over the ear and place the prescribed number of drops into the ear canal. For adults, hold the earlobe up and back to help the drops roll into the ear. For children, hold the earlobe down and back. Keep the head tilted with the treated ear upward for 5 minutes or insert a soft cotton plug if directed. Another option is to place a cotton wick in the ear canal and moisten it with the prescribed number of drops as often as directed. The wick should be replaced at least once a day. If directed, repeat these steps for the other ear. Do not rinse the dropper and be sure to replace the cap after use. It's important to use this medication regularly to get the most benefit from it. Try to use it at the same times each day to help you remember. Even if your symptoms improve, continue to use the medication for the full time prescribed, usually up to 10 days. Do not use this medication more often than prescribed or for longer than 10 days. If your condition lasts or gets worse, be sure to contact your doctor. When using Neomycin-Colist-Hc-Thonzonium Drops, suspension, you may experience a temporary stinging or burning sensation in your ear for a minute or 2. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's essential to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks. Many individuals who use this medication do not experience serious side effects. However, it's crucial to contact your doctor immediately if you experience any serious side effects, such as hearing problems or signs of a new fungal ear infection after prolonged or repeated use. While a severe allergic reaction to this medication is rare, it's important to seek medical help if you notice symptoms such as rash, itching, swelling, redness of the ears, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice, or report any side effects to Health Canada. Before using Neomycin-Colist-Hc-Thonzonium Drops, suspension, it's important to let your doctor or pharmacist know if you have any allergies to neomycin, colistin, hydrocortisone, thonzonium, aminoglycoside antibiotics, or corticosteroids. This medication may contain inactive ingredients that can cause allergic reactions, so be sure to discuss any allergies with your pharmacist. Also, be sure to inform your doctor or pharmacist of any other ear problems you may have, such as a hole in your eardrum or a middle ear infection. If you have an ear infection caused by a virus, such as herpes simplex or varicella, it's important to let your healthcare provider know before using this medication. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, as it should only be used if clearly needed during pregnancy. Additionally, it is unknown if this medication passes into breast milk, so be sure to consult your doctor before using this medication while breastfeeding. When using Neomycin-Colist-Hc-Thonzonium Drops, suspension, it's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It's essential to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval to ensure your safety and optimal treatment effectiveness. If someone takes too much of this medication and experiences severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should get in touch with a poison control center right away. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It's important to note that this medication can be harmful if swallowed. This medication is prescribed specifically for your current condition, so it's important not to share it with others or use it for another infection unless directed by your doctor. It's crucial to keep the infected ears clean and dry, so try to avoid getting them wet when bathing and refrain from swimming unless advised by your doctor. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take your next dose at the usual time. Don't take a double dose to make up for the missed one. Make sure to store this medication at room temperature and away from heat and light. It's important to keep all medications out of reach of children and pets. It's crucial not to flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When this product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on the proper way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.